For the discussion, focus on any learning points and unique aspect about your case and compare and contrast your case with other studies and case reports that have already been published. Make reference to any relevant guidelines like local or national guidelines. Things to include are compare your findings to what's known in the literature and what you think or why you think this case is different. Only discuss what is relevant to your case and do not provide any unproven or unsupported speculation. Acknowledge and explain any ambiguity or unexpected feature that have occurred. Even if it's contradicting to your concepts, explain how the case could be contribute to the literature and suggest justifiable recommendations. So to quickly skim through the discussion example by case report, acute testicular pain is a common presentation in young adult males, primarily due to epididymitis and testicular torsion, but rarely due to testicular tumors. In comparison, the common incident of testicular, torsions per year is relatively rare, accounting for 1 to 2% of cancers among men in the United States. The common presentation of testicular tumor is the painless testicular nodule or swelling with negative transillumination test. Unlike our patient who initially presented with testicular pain, which usually leads to diagnostic delays due to uncommon presentation. Diagnostic delays is a very well-recognized phenomenon in literature, and previous studies reporting that up to 1/3 of testicular tumors are initially misdiagnosed of epididymitis or hydrocele. And there's an example of a case written by back in 2017. And this case ultimately led or illustrates a scenario that ultimately led to a delay of ideal management. And I also brought in other examples of other cases where a misdiagnosis led to delay in treatment. So with the discussion part out of the way, we can move on to title and abstract. So abstract is an important part of your article as it will be freely accessible for others to read when retrieved from any medical databases during relevant searches. However, it is typically the last part written in your article. Things to include is a brief summary that gives a general idea of the contents of the case report. It should not include any references or abbreviations and should not exceed 350 words. So ideally, you want to keep it under 250 words. Remember, it's a summary and an ad for your article. You want to check your journal's instructions for detailed guidelines on word count. The abstract is usually arranged into 3 subsections, which includes the background, case presentation, and conclusion. The background should clarify the importance of reporting such a unique case. Afterwards, a brief description of the clinical scenario of the patient listing only the important details. Finally, the conclusion should be brief with lessons learned and the impact on the interested group. And when you're writing your title, just make sure it's something catchy, but also conveys the key message. So if you look at my case report title, I made sure to add metastatic, tumor, and emergency departments. I felt like those are pretty eye-catching words. I'll go over my abstract. So testicular neoplasm or testicular cancer are not typically seen in the ED since their presentation involves a painless hard mass that emerges slowly over time. Uncommon presentations of testicular neoplasm in the ED with acute onset of scrotal pain may present challenges as an incomplete physical examination without supplemental imaging and laboratory workup may overlook the diagnosis of testicular neoplasm. As a result, a delay in proper treatment may occur. Early recognition of testicular neoplasm can decrease morbidity and mortality and improve overall patient survival. Here we presented a case of a 32-year-old male who presented into the emergency department with an acute onset of testicular pain localized to the posterior right side of the scrotum. Despite the unusual presentation, a complete physical examination, including a complete GU system exam, was performed. During the physical examination, a high index of suspicion for testicular neoplasm was present. Necessary imaging and laboratory workup were ordered. Based on the finding, a tumor was suspected. Thus, surgical intervention was pursued to remove the mass, and pathology reviewed mixed germ cell tumor. Further imaging and workup studies showed metastasis to other organ systems, and medical management was chosen to treat the metastatic neoplasm systemically. So that was the introduction and the title and the abstract. Lastly, we could focus on the conclusion. So this section should include a concise and brief statement explaining the importance and relevance of your case, and it should relate to the purpose of the paper. So again, going back to my case report, scrotal pain is an uncommon presentation of testicular tumor as presented in our case report. Our recommendation upon reviewing our case would be testicular neoplasm should not be overlooked for a patient presenting in the ED with sudden onset pain localized to posterior scrotum, as this could change the management and outcome. In addition, a complete GU physical examination should be included, and testicular tumors should be included in the differential diagnosis. And one must obtain imaging and tumor markers such as AFP, LDH, and beta HCG earlier in the workup. These steps may help identify testicular tumors early, which could result in a better treatment outcome. So that's pretty much the core components of a case report. As I said, and as I mentioned in the beginning, it's relatively simple to write up in a weekend. You do need to take the time to do some literary research, and sometimes it may take some time to follow the patient and get the whole total treatment plan and outcome. So once you're done finishing writing up your case report, what you could do is present your case report via oral or poster presentations to meetings, research fairs, or national regional conferences. You could also publish it on medical journals. My advice would be get a reputable journal that's also indexed in PubMed. And also you can contact our research committee. We have a list of recommended journals for publishing. So you could just shoot us an email. Additionally, I want to invite my guest speaker, Hussein Aden. I consider him as a mentor, and he taught me a lot in terms of research and how to write case reports. So let's see if he's still in the chat.
Perfect. Yep, still here, still here. Hey, everybody. Right. Wonderful presentation, Austin. You covered it really well. The way that Austin broke it down by starting with the case presentation and then kind of working backwards, kind of reverse engineering it is a great way to go, because the case presentation is the bulk of the case report. So having that done and having that done well sets you up to do the discussion and the introduction, the title afterwards. My name is Hussein Aden. I'm a fourth-year student. I am the former SGA research chair. I've been the chair since January 2022 until last month when Nicole took over. And before me, it was Dr. Matt Barvo, who was the first ever research chair. So I was the second and Nicole was the third. And I'm really excited about what's happening here at Trinity Student Research, because there's a lot of new things coming along. We have a new SGA board who are very motivated and hungry to bring opportunities to the Trinity clinical student base. We also have two new deans who are very research oriented. So I'm really excited and happy that things are moving in a great direction when it comes to research at Trinity. Just a little bit about myself. I went to the University of Michigan for undergrad. I studied sociology, and I was fortunate enough to work at the Life Science Institute for 3 years. At the time in 2015, it was cutting edge. We were working with the CRISPR-Cas9 gene editing system, and that was cutting edge back in 2015. Published on 3 journals. I've attended 2 conferences. Most recently, the American Society of Anesthesiologists annual meeting in San Francisco, where I presented 2 posters this past weekend. And I'm really excited to share my experiences and lend my experiences and insights to Nicole, the chair, Austin, the co-chair, and Omar Hussein, who will also be part of the subcommittee. So I wrote down a couple of things. Just Austin has talked about them, but I'll go over them briefly. It's a list of 4 questions. First, why do research at all, right? Why should you do research? First of all, research is a way for you to learn. So I'm sure Austin can attest to the fact that his case report about gonadal or testicular cancer, he knows everything. He knows so much more than the average person when it comes to testicular cancers. He can tell you at length about it. And with me, I've done research on treatment-resistant depression. I've done research on atrial myxomas. I've done research on uncross match transfusion of blood. And those topics I am very well versed at. So the first thing that research will do for you is it will give you learning. It will allow you to be well versed in whatever topic you decide to research. That's the first thing. Another thing is that it demonstrates academic curiosity. And secondly, it looks good on your CV. Another point I wanted to make is that other medical schools that are not Trinity, that are not international schools, who are better resourced. One example is Mercer. Mercer clinical students actually have 4 months of dedicated time to do research during their third and fourth year. At Trinity, unfortunately, we don't have that, so we have to kind of make do with what we have. But what we do have is a strong and reputable SGA presence, and we have 2 new deans who are interested in research. So if you want to do research at Trinity, you have every opportunity as much as any other school. And the last thing is that keep in mind that during residency, you'll also have to continue doing research. So you can duck research during medical school if you'd like, maybe match with having no research at all. That's fine. But when you get to residency, you are still going to be required to do posters, abstracts, and publications throughout residency. So getting a head start and getting acquainted with research during medical school will set you up for success in residency. The next question is, how do you do it? Firstly, connect with classmates who have a shared interest. For example, if you know a classmate who's also applying into OB-GYN, connect with them, see if there's similar topics that you guys are both interested in, and start looking into them. Whether you actually follow through and do that topic is one thing, but finding classmates who have a shared academic interest is the first place to start. Next is obviously reaching out to a well-trusted or a well-known preceptor and asking them for case files, or asking them, is there something that you're interested in that, for example, let's say for Dr. Shekarapa, you're rotating Dr. Shekarapa, you can say something like, Dr. Shekarapa, is there a case recently that you've seen that was really fascinating to you, that I want to know about it? Most physicians, for example, like Dr. Shekarapa, won't have time to research these things because they're running a clinic, they have a full-time job. But us students, we have a little bit more time. So asking a preceptor either for case files or a case topic that they're interested in is a good place to start. And then besides